So, thank you so much for joining us for the next part. Kathy has reviewed the heart chakra in beautiful detail. So, now let's visit on some of the anatomical science and what's going on inside of you physically. The major structures of the heart chakra include the heart, the lungs, the thymus gland, the shoulders, the spine, in particular the thoracic spine, and the ribs. So during this session, we're going to cover each of these physiology and anatomy. And in particular, as we're covering this, you can start to explore how each of these structures feels inside of you physically. And this will be an excellent place to focus when we move on to the sound healing session. As Kathy and I were working together, one of the things that Kathy said as she was guiding us through the chakras and through the heart chakra, that a lot of the times when we're learning about chakras, especially in Western society, we start with the first or the root chakra. But it does seem like intuitively everything starts with the heart chakra. So it turns out when we get into the anatomy and how we were made and we were formed, one of the first organs that actually forms inside of us humans is our heart. Kathy and I both feel that this is where everything starts. And sure enough, embryology tells us that one of the first organs that's going to work in a human embryo and a baby is a beating heart. About the time a woman's pregnancy test turns positive, there's actually a beating heart already there. The heart, or the cells that form the heart, the actual organ of the heart, are actually active and working about 21 days after conception. The rest of our organs form all around that, which is quite incredible to think. The heart chakra is actually growing, the heart itself is actually growing long before the nervous system even has a chance to develop. I'd like to share with you a video that I found on YouTube that beautifully illustrates the development of the human heart. So I'm so grateful that these creators created this beautiful graphic that will walk us through what is happening that first 21 days that our hearts are developing. So as far as the organs that are in the heart chakra is the heart itself. The heart consists of 4 parts. So when I'm working with my patients, this is how we explain it. You got 2 top, 2 bottom, you got a left and a right. So that makes 4 chambers, which interestingly enough, and I've explored this concept with quite a few people, that often in numerology, we associate the number 4 with the heart. I've asked around and no one really knows why, but we actually have 4 chambers of the heart. In the heart, you have the top chambers, which are called the atria. They're smaller. Basically, their job is to have blood get into the heart and to get it into the next level, which is the bottom chambers or the ventricles. The ventricles are bigger. They're also stronger. The muscle that goes in the ventricles is bigger, and so that's why you get that shape of the heart where the top is smaller and the bottom is larger. And then you've got the left and the right. Simply thought of, the right side of the heart is trying to get blood into the lungs. That's its primary job. And then the left side of the heart is trying to get blood into the rest of the body or into circulation. So whenever your heart beats, or we get the lub-dub that we think of, that is from the action of what's called the valves inside the heart. So these chambers are separated by valves that open and close. So whenever a doctor listens to your heart, or if you've ever listened yourself with a stethoscope, you hear a lub and then you hear a dub. And those are basically just different valves that open and close and allow blood to pass through. When the heart beats, it's a very coordinated event. We take it for granted because we get so many beats a day, beats in our lifetime, that it's so easy to forget this miraculous machinery is doing this coordinated dance every beat. But first the top contracts and then the bottom contracts. And so that has to happen in a somewhat coordinated fashion. Sometimes it doesn't happen all together. So Kathy was telling us a little bit of what would happen when her heart was acting up, when she was getting what's called an arrhythmia. And that's when heart rhythm is wrong. That can be too fast, too slow, irregular, a number of things. But we do need this lub and dub to happen in somewhat coordinated fashion so that the blood travels throughout our bodies, travels to our brain, and also travels to our lungs. The heart rate is controlled by several factors. Interestingly enough, the heart itself can determine how fast it will beat. It has its own nervous system inside the heart. And what I tell my patients is that there are 2 brains inside the heart. That's a very rough definition, but they're 2 nodes that take signals from the rest of the body, particularly the vagus nerve, that determine when the atria and the ventricle will contract. And there's wiring inside the heart that's going to take signals from the top to the bottom of the heart. So all of that's just basically to coordinate how fast the heart will beat. This illustration I'm showing gives us an idea of this nervous system that's within the heart. So where number 1 is located, that is the atrioventricular node. And that's the tiny brain, or a bundle of nervous tissue, that determines when the top of the heart, or the atria, will beat. Where number 2 is, that shows us where the second bundle of nervous tissue is, called the SA, or sinoatrial node. And then you'll see traveling from that number 2 branches that go throughout the center of the heart, which is called the septum, and then into the muscles of the heart. So this collection here is the nervous system of the heart that determines how fast it will beat. So it's nice to see it outlined and illustrated by the creator J. Hauser, who created this beautiful image that shows us how the heart can determine how much and how fast it will beat independent of the rest of the body. The heart can take signals from the external environment, from the vagus nerve, from various hormones circulating within the body, including adrenaline hormones, thyroid hormones, and other similar hormones. The heart can also beat independently. It can also determine its own rhythm if for some reason the external signal is disrupted. So that's a rough description of the heart, which is a very complex organ. Within our heart chakra, we also have our lungs. So our lungs are large organs that we have two sets of, but each side somewhat differs from the other. So on your right side, because you don't have a heart in its place, you get a little bit more lung space than you do on the left side. Both sides do work together so that when we inhale, air actually travels in from our larger airways into the lungs. Expansion of the lungs is driven by our inhalation, both subconsciously and consciously. It's also driven by just the lungs pushing out themselves. And then when we exhale, our air comes out, same way in part from the lungs somewhat releasing the air, but also from our ribs. There are muscles in between each rib called intercostal muscles that gently contract. They help bring the ribs closer together. And between that and the diaphragm, which is the large muscle that sits underneath the lungs, when those come together, then we exhale the air. Also within the heart chakra, what I consider is an important part is part of our spine called the thoracic spine. So our spine, we think of in three major parts. We as humans have large heads that sit on top of a cervical spine. That's your neck. We usually talk a lot about our lumbar spines or our lower backs. And in between is a thoracic spine. And that's the spine that supports the ribs. It supports the lungs. And depending, and Kathy's going to guide us through talking about some of these blockages, can sometimes be a site of disease process related to the heart chakra. When the thoracic spine is nice and in line, the lungs can open and expand easily. We breathe easily. And when our breath is nice and easy, our heart rate can stay nice and normal. It can take a preference to a slower rate, which is what it prefers, rather than a more rapid rate. Some scientists consider the shoulders as part of the heart chakra, as even a joint of movement, but having good alignment in the shoulders supports the ribs and the breathing. So the shoulders can be considered as well as part of the heart chakra. In the chakra system, as Kathy was reviewing us, that we have several chakras depending on the school of knowledge you're coming from. Most chakras have a gland. In the heart chakra, the gland that's associated there, the most active gland is actually the thymus. The thymus is a gland that's behind the breastplate or the sternum. It's actually pretty large when we're babies and when we're kids, and then it shrinks over time. Its primary job is to train the immune system on what to attack and what not to. So it has a very specific job in training what's called our T cells. So of course, when we're younger, our immune system has to train much more. Once we're older, it doesn't need as much training, but the thymus can be a source of disease, particularly with the immune system. So that's our review of the anatomy of the heart chakra.